Hi, I'm Garvin. This telecast is on Zocor. So Zocor, or the chemical ingredient Simvastatin, is used along with diet if you have a raised cholesterol level in your blood or elevated fat levels in your blood. If you have a hereditary illness that increases the cholesterol level in your blood, you may also receive other treatments. It's also used for coronary heart disease, or if you're at high risk of coronary heart disease because you have diabetes, history of a stroke, or other blood vessel disease. Zocor may prolong your life by reducing the risk of heart disease problems, regardless of the amount of cholesterol in your blood. So how does it work? The drug in Zocor belongs to a family of drugs called statins. It prevents the production of cholesterol by the liver and consequently reduces the levels of cholesterol and other fats or triglycerides in your blood. So when and how do you take it? Swallow each tablet whole with a drink of water. Take Zocor in the evening. If you can take it with or without food, doesn't make any difference. Grapefruit juice contains one or more components that alter how the body uses some medical products, including Zocor. Consuming grapefruit juice should be avoided. So what's the usual dose? The dose of Zocor, 5 mg, there's a 10 mg, a 20 mg, a 40 mg or 80 mg tablet by mouth once a day. The 80 mg dose is only recommended in patients with very high cholesterol levels and at high risk of heart disease problems. The usual starting dose is 10, 20 or in some cases 40 mg a day. Your doctor may adjust your dose after at least 4 weeks to a maximum of 80 mg a day. Do not take more than 80 mg in one day. Could it interact with other tablets? It is particularly important to tell your doctor or pharmacist if you are taking any of the following drugs. Taking Zocor with any of these drugs can increase the risk of muscle problems. Cyclosporin is a medicine often used in organ transplant patients. Danazol, a man-made hormone used to treat endometriosis, and medicines like itraconazole or ketoconazole for fungal infections. Fibrates like gemfibrozole and bezofibrate, they're medicines for lowering cholesterol. Erythromycin and clarithromycin, or fusidic acid, they're antibacterials. HIV protease inhibitors such as indinavir and nelfinavir, medicines for treating AIDS. And nefazodone, a medicine for depression. Amiodarone is a medicine for irregular heartbeat. Verapamil or diltiazem, medicines for high blood pressure, chest pain associated with heart disease. As well as the medicines listed, you tell your doctor or pharmacist if you are taking or have recently taken any other medicines, including those obtained without a prescription. In particular, tell your doctor if you are taking any of the following medicines. Medicines to prevent blood clots, such as warfarin, which is an anticoagulant. Fenofibrate, which is another cholesterol-lowering medicine. Niacin, which is a medicine for lowering cholesterol. So what are the possible risks or side effects? The following are serious side effects. If any of these serious side effects happen, stop taking the medicine and tell your doctor immediately, or go to the A&E department at the hospital. Muscle pain, tenderness, weakness or cramps. On rare occasions, these muscle problems can be very serious, including muscle breakdown, resulting in kidney damage, and very rare deaths have been occurred. Hypersensitivity or allergic reactions, including swelling of the face, tongue and or throat, which may cause difficulty in breathing. Severe muscle pain, usually in shoulders and hips. Rash with weakness of limbs and neck muscles. Pain or inflammation of the joints. Inflammation of the blood vessels. Unusual bruising, skin eruptions and swelling. Hives and skin sensitivity to the sun. Fever or flushing. Shortness of breath and feeling unwell. Lupus-like disease picture, including the rash, joint disorders, and effects on blood cells. Inflammation of the liver, with yellowing of the skin and eyes, itching, dark-coloured urine, or pale-coloured stool, and liver failure, which can also occur. And very rarely, side effects would be inflammation of the pancreas, often with severe abdominal pain. Low red blood cell count or anemia, numbness or weakness of the arms and legs, headache, tingling sensation and dizziness. digestive disturbance, abdominal pain and constipation, flatulence, indigestion, diarrhea, nausea and vomiting. Also rash, itching and hair loss, weakness as well. So can you drink alcohol with Zocor? Alcohol intake should be kept to a minimum. And for pregnancy and breastfeeding, Zocor cannot be given while pregnant or during breastfeeding. It's contraindicated. If you have any questions, you can ask me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.